Hey guys, Dr. Don here. Welcome back to my channel. Today we're going to be talking about 5 dietary tips specifically for diabetics. Now, I will tell you that there is no one diet that works for everybody. Now, if you hang around till the end of this video, I'll tell you exactly what I mean by that statement, because there truly is not one diet that's going to be beneficial to every diabetic. Now, I'll give you a little tip. But again, if you stay till the end of the video, I'll explain to you exactly what I mean by that statement. But my tip is the amount of carbs, fats, and proteins that you're consuming is less important than how the food that you're consuming actually interacts with your physiology. Broccoli and chicken can interact differently with you than it does with me. And so again, stay till the end of the video and I'll explain to you exactly what I mean by there is no one diet that's gonna work for everybody. Now let's go ahead and dive into these 5 dietary tips for diabetes. All right, tip number 1 is understanding carbohydrates. We need to understand which carbohydrates we need to be consuming and which carbohydrates we need to avoid. Now, most people, when they think of carbohydrates, they think of bread and pasta. Well, the reality is I'm going to give you a list of foods that all contain carbohydrates. So things like dairy, fruits, vegetables, right? Grains, nuts, legumes, even seeds. Now, a lot of people don't understand that sugary foods like candy and soda and cakes and cookies are also carbohydrates. So what do we need to understand when it comes to carbohydrates? Well, carbohydrates are made up of 3 different components. You have fiber, starch, and sugar. So your fiber and your starch are going to be more of your complex carbohydrates, and your sugary foods are going to be your simple carbohydrates. Now, the complex carbohydrates take a lot longer to break down, so you don't have such an initial glucose load when you consume complex carbohydrates versus simple carbohydrates. Now, simple carbohydrates are your sugary foods, and these are broken down very, very quickly, which causes an insulin and a glucose surge. Therefore, it's going to perpetuate, it's going to cause the insulin resistance or the type 2 diabetes to continue to progress. So clearly, we want to definitely be staying away from simple carbohydrates. But what complex carbohydrates should we be consuming and which complex carbohydrates should we be avoiding? Let's talk more about that. Okay, so a couple different things that we're looking at when it comes to complex carbohydrates. Number 1, we're looking at the starch-rich complex carbohydrates, also going to look at the fiber-rich complex carbohydrates. And so not only do we want to look and make sure that we're not putting too much carbohydrates in our system at once, that is going to cause a sugar spike. But secondly, we want to make sure that we're not putting inflammatory foods in our body. See, regardless of what kind of doctor you are, the one thing that we all agree on is that inflammation drives all disease. And so even if it's a low carbohydrate food, if it's causing inflammation in the body, that's something that we obviously want to avoid. And so all of our simple carbohydrates, which is made up of raw sugar, of brown sugar, sucrose, which is table sugar, even fructose that comes from our fruits. We want to make sure we're not doing a whole lot of fruits. But our corn syrups, our high fructose corn syrups, our juice concentrates, we absolutely want to avoid those, not only because it's going to cause a glucose spike, but also because those foods are very processed and very, very inflammatory when you consume them. So again, let's look at the complex carbohydrates. We want to lean more towards the fiber-rich complex carbohydrates. So these are your vegetables, your fruits, right? When you're eating the fruit, the fiber helps to delay the fructose being released into your system versus just drinking fruit juice, which doesn't have a lot of the fiber content and therefore is going to cause a pretty quick sugar spike, right? Now also our nuts and our beans, very, very good sources of protein, also very good sources of fiber, really help with digestion, help with bowel movements, also help to stabilize our blood sugar. Now, whole grains are considered a fiber-rich complex carbohydrate, But at the end of the day, the whole grains in our country, they're so processed, they're so hard to digest. They may be a little bit beneficial when it comes to digestion, but they are going to cause inflammatory responses, especially grains that contain gluten. Your gluten is a very sticky protein that's very problematic. Even if you're not sensitive or allergic to gluten, we really want to minimize or eliminate gluten-rich foods just because of the impact, the negative impact that it does have on your digestive system and on your immune system. Okay, now the high starch foods are definitely foods we want to minimize when we're struggling with diabetes. Now, as you're moving through my program and you're getting better glucose control, you're getting better sugar control, then you're going to be able to implement more of these foods without problems. Early on, when you're completely out of control when it comes to your diabetes and your blood sugars, we really want to eliminate these high starch foods until your body is able to process them and then process the glucose more efficiently. And so we absolutely want to stay away from whole wheat breads. Believe it or not, whole wheat breads in a lot of cases are going to spike your sugar more than white bread. Now, obviously we want to stay away from white bread and white flour just because of the inflammatory issues that those foods bring. But even the whole wheat breads, we really want to minimize and even eliminate them in many cases until your body can become better controlled when it comes to your blood sugar. Now, listen, cereals, breakfast cereals, kid cereals, there is cereals out there that are great and good for you as long as you're using the almond milks or the coconut milks or the cashew milks. Again, dairy, very inflammatory, right? But a lot of these cereals very full of sugar and starch, okay? And so we absolutely want to stay away from these sugary cereals. Corn is a grain, very hard to process. Your oats, a lot of people are doing oatmeal. They say, Doc, I don't consume any sugar, and they start their day off with oatmeal and a banana, right? And so the oats, again, in many cases, in most cases, it's going to cause a glucose spike. I would eliminate the oats right now. And then obviously your rice, especially your white rice. But those of you that have sugars up in the 200s, you're not even able to handle things like brown rice, basmati rice, jasmine rice, wild rice right now. And so again, to get great results quickly, I would eliminate rice from your diet as well. So again, guys, we want to completely eliminate your simple carbohydrates, which are those high sugar foods. And then when it comes to the complex carbohydrates, we want to lean towards the more fiber-rich complex carbohydrates and lean away from the more starch-rich complex carbohydrates. All right, let's move on to tip number 2. All right, tip number 2, and this may be the most important tip that you get from this video. Maybe I should have made it tip number 1, but it's just so important for you to understand carbohydrates because you can't just blanket statement, you need to do this amount of carbs a day, because it really depends on what type of carbohydrates that you're consuming. So that's why I made that tip number 1. Now, tip number 2 is water, H2O. The most important thing we need to be putting in our body every day, all throughout the day, is water. I cannot stress how important it is to make sure that not only are you consuming good quality water every day, but make sure you're consuming enough water every day. Now, some of the things that can clear up, a lot of people have symptoms of fatigue and headaches and dry skin and brain fog. All these things directly related to dehydration. See, you should never get thirsty. Your urine should never be yellow. If your urine is yellow and you're thirsty, you're already dehydrated. Your cells are already becoming dehydrated. Your systems are slowing in function. You are moving towards a sicker and sicker lifestyle if you're not consuming enough water on a daily basis. And so let's talk about what kind of waters. Obviously, spring water is very good, full of a lot of minerals. I personally drink reverse osmosis water that I have coming out from the top of my sink. But again, if you're drinking reverse osmosis water, there are no minerals present in that water. So if you're drinking enough water, Doc, how much is enough water? Great question. What you need to be doing is you need to be drinking half your body weight in ounces of water every day. So if you're 100 pounds, you drink 50 ounces of water a day. 200 pounds, you drink 100 ounces of water a day. Now, for patients that I initially start working with and they're very obese, very overweight, if the amount of water that you're supposed to drink, if half your body weight is more than 128 ounces, then I tell you to just shoot for a gallon. Gallon's 128 ounces. So if you're 300 pounds, don't try to initially start drinking 150 ounces of water a day. Start shooting for a gallon a day. Now, for those of you that say, man, I just can't drink water, I feel like my eyeballs are floating, I feel so bloated. If you're not used to drinking enough water, initially when you start to drink water, your body doesn't know what to do with it. And so you're gonna urinate a lot more often, you're gonna feel a lot bloated. I tell patients, I know your eyeballs feel like they're floating, but hang in there. Your body has to understand that it can start utilizing this water that you're putting into it, because if you don't give yourself water very often, when you do give yourself water, it's gonna really wanna retain that fluid and hold on to it because it's just chronically in a dehydration sense. Your body's just in that state. And so, again, we want to make sure we're doing plenty of water. Reverse osmosis or spring water, very, very good. Now, a couple other things we want to pay attention to. Number one, we don't want to be drinking out of plastic. A lot of the chemicals that are in the plastic, when they heat up and cool down and heat up and cool down, a lot of times they've been in these plastic bottles for months and months before you consume them. So we really want to minimize the amount of plastic that we're using. I've installed a reverse osmosis system under my sink here for a few $100s that we're able to put it straight from the filter system into a glass jug so that we're not dealing with plastic. Now, if you don't have any choice right now, and what I recommend doing is what we did before, is we found a local water source to where I was getting it directly from the source. The plastic jugs, it was a very thick, high quality plastic, but it was only in that plastic for a very short amount of time before it actually got into my house and we were able to put it into glass. So, if at all possible, we want to avoid plastic, but if you have to do plastic, try to get it from a local source so it's not in the plastic for months and months, okay? Water, very, very important. Now, if you're drinking reverse osmosis water and you're not getting in your minerals, doc, how do I get my minerals in? And some of my diet videos, I do talk about salt and other ways to get your minerals in your body. Very, very important to make sure you're restoring your mineral content. Now, a lot of you are told to have a low to no salt diet. And when it comes to table salt, ionized salt, it's broken down, it's bleached, it's got some toxins put in with it to make it non-clumping and to last longer. We don't want to be doing any of that type of salt. Absolutely none of that salt. But when it comes to Celtic sea salt or pink Himalayan salt, these are salts that are unprocessed. So the gray is the Celtic salt. That's what it looks like in its natural form. The pink Himalayan salt obviously is pink. But these have the 88 trace minerals that is essential for your body's function. Essential, guys, means you have to have these minerals in order to survive. And so the best way to get the minerals back in your body is by doing about a teaspoon of this good high quality salt. Again, it's Celtic sea salt or it's pink Himalayan salt, the only two salts that I recommend for my patients. But we want to make sure we're doing enough. I'll either put some in my water or I'll put a pinch in my mouth, especially when after a workout, when you sweat a lot, you're going to sweat out your minerals. So you need to replenish them when you're putting your water back in your body. Guys, make sure you're drinking enough water. You'll be amazed on how many things will clear up. Anything from your energy levels to your skin conditions just by drinking adequate amounts of water. All right, tip number 3, replace bad fats with good fats. See, fat is essential for us to be consuming fats. Now, we need to make sure we're consuming the right fats, and we need to make sure that we're able to break down and emulsify the fat so that we can absorb the nutrients out of that fat. And so, yes, we need to have a good functioning gallbladder. If you don't have a gallbladder and you haven't been told that you need to supplement when you eat so you can break down your fat, please reach out to me. I will point you in the right direction. Very, very important. The number one most common surgery today is gallbladder removal. So many people out there don't have a gallbladder, and so important for proper digestion to have a gallbladder. Now, if you don't have one, it's okay. We need to just support that digestion process, and so I can talk you through that. Now, we need to make sure that we're taking in a lot of good, healthy fats. Fat is essential for so many things. You need fat to produce your hormones. And so when we have deficiencies in sex hormones, stress hormones, all of your hormones in your body, we need to be consuming good, healthy fats in order to produce adequate amounts of those hormones. It's important for brain development, mental clarity. actually good fats help to reduce inflammation in your body, whereas the bad fats, the rancid fats, the fats I'm going to talk about here in just a minute, they're going to increase inflammation in your body. So what are bad fats? What fats do I need to avoid? These are fats like hydrogenated fats, partially hydrogenated fats, trans fats. These are things like vegetable oils, canola oils, soybean oils, corn oils, cottonseed oils. Any kind of hydrogenated or partially hydrogenated oils are going to be very, very detrimental to your overall health. So if we're cooking with canola oil or vegetable oil or these type of oils, we absolutely need to stop doing that, because all you're doing is causing more and more inflammation in your body, which is going to perpetuate any kind of disease process that you're dealing with. Now, things like olive oil, coconut oil, avocado oil, grapeseed oil, very, very good oils. Now, it all depends on the temperature of these oils as far as, are they safe and healthy or are they not? See, when you heat olive oil, it breaks the bonds apart. It becomes a rancid fat, just as bad as canola oil and vegetable oil. So we want to make sure we're not heating up olive oil, because it's just not stable at high temperatures. Now, if you want to drizzle that on your salads, or if you want to drizzle on your meat after it's done being cooked, completely fine. Very, very good fat at room temperature. Now, if we're going to be cooking with oils, we want to make sure we're using high heat stable oils. My two favorite are coconut oil and avocado oil. These oils are very, very stable at high temperatures, something that you're going to be able to very much benefit from. When people say, well, I just can't eat fried foods anymore. Well, you can if you're cooking them in good fats, and the breading is made of a good breading, a good almond flour or coconut flour or tapioca flour, one of these flours that is not inflammatory. So you can still have fried foods if you're using good breading and if you're using good fats, okay? So again, we want to make sure we're doing lots and lots of good healthy fats, because all these trans fats and the canola oils and vegetable oils, they've clearly been linked to heart disease, inflammation, strokes, cancers, diabetes, and many, many more diseases. So we want to absolutely make sure that we're staying away from the bad fats. We want to be consuming good amounts of the good fats. And then when it comes to cooking the oils, we want to make sure we're using heat stable oils to cook at high temperatures. Now, if we're going to cook at like a moderate temperature, I'm okay using grapeseed oil. But once we get it up over a certain degree, it's just not as stable as something like coconut oil and avocado oil. All right. So again, guys, avoid the bad fats, lean towards the good fats, and then also make sure that we're able to break down and emulsify those fats with proper digestion. All right. Tip number 4, protein, protein, protein. Guys, we need to be consuming high quality protein each day, and it's most beneficial to consume the protein towards the beginning of your meal, okay? It's just gonna really help with digestion. It's gonna really help to stabilize these blood sugars. And so again, we wanna make sure we're eating good, high quality protein. It's better to consume it towards the beginning of your meal. And so what is good, high quality protein? Well, guys, when it comes to animals on our planet, you want to be consuming them in their natural state, meaning that they're eating what they're designed to eat. Because if an animal is being fed foods that it's not designed to eat, it's going to throw off their amino acid ratios, it's going to cause their systems to be very inflammatory, and it's going to cause modern day disease. See, a lot of research has been done on commercial meats and commercial fish, farm-raised fish, and there is a lot of research that links these foods to heart disease, to cancer, to diabetes, because they're so inflammatory. See, the omega-3 omega ratio is very, very important in the meats that you're consuming. And when fish are eating out of their natural habitat, and when cows and lamb and chickens are eating in their natural habitat, their omega-6 and omega-3 ratios are going to be balanced, which is going to create a very, very healthy meat and healthy protein. But when they're eating more of a corn-based or a grain-based meal, their omega-6 ratios are going to be extremely high, their omega-3 ratio extremely low, and again, this causes the meat to be very, very unhealthy. Now, not only the omega-3 and omega-6 ratios, but also the hormones and the antibiotics and the steroids, all of the things that they're giving these animals, again, it's getting into the meat, which is getting into your system, which is just, it's detrimental to your hormones, it's detrimental to your gut health. So again, we want to be consuming good, high quality meats. And so when it comes to your beef and your bison and your chicken and your pork, we want to make sure we're getting organic, grass-fed, free-range meats. When it comes to your fish, we want to make sure it is wild-caught fish. For salmons, I would try to avoid more of the Atlantic salmons are a little higher in mercury. But again, if it doesn't say if it's wild-caught or farm-raised, assume it's farm-raised. Most restaurants, unless you go to some high-end restaurants, when they're serving salmon, they're using a farm-raised salmon. Again, very high in omega-6, very low in omega-3. At the end of the day, it's going to cause a lot of inflammation when you consume that. So absolutely no farm-raised fish, and then absolutely no commercialized meats. Same thing with your eggs, okay? The eggs, you want to make sure that they're grass-fed, free-range, organic. If they're eating a bunch of pesticides and herbicides, it's like you consuming bug spray, which you would never do, obviously. But when you're consuming these foods that are consuming grains and things that have been sprayed by those toxins, at the end of the day, they're going to get into your cells, they're going to get into your tissues, they're going to cause your body to be full of toxins, and at the end of the day, move you closer and closer towards a disease process and farther away from being healthy. So good quality meats, free range, grass-fed, organic, very, very important. I want to make sure we're avoiding all farm-raised fish. Okay, make sure we're getting wild-caught fish. Very, very important. Also, protein can come from nuts and seeds. Also come from beans and legumes. As far as the nuts and seeds go, we want to make sure we're doing organic, definitely, because they're getting sprayed with all the bug sprays out there. We don't want to be consuming that. Raw is typically the best because most of the oils that they use, remember we just talked about good fats and bad fats, a lot of times they're using bad oils, bad fats to roast these nuts in, and now a very, very healthy organic nut became unhealthy because of the oil that they cooked them in. And so if you do like roasted nuts, what I like to do is I like to get raw organic nuts, go ahead and bring them home, throw them in the oven, and roast them in good healthy oils with some good healthy sea salt. My goodness, it's amazing. But again, if you're using good healthy fats, you're using good healthy salt, it's completely okay. It's actually very, very good for you. Very good source of protein, very good source of fat, and very good source of those mineral replenishment using that sea salt. So again, same thing with the beans. Beans are also a great source of fiber, beans and lentils, but want to make sure we're doing organic. We want to stay away from canned as much as possible because just again, the toxins they spray inside those cans are leaching into the foods. So organic and raw, cook them up. You know, you can look up recipes on how to cook your beans up. The best way to do it, spend some time in the kitchen, put in that little extra effort. That's going to make a huge difference when it comes to your overall health and the ability of your body to heal. All right, the last tip, and something that a lot of people are doing because it's so ingrained in us, and you can finish this sentence. This tells you how ingrained it is in us. Milk does the body good, right? That's what we all have been told for years as a little child, even to now. Commercials are still saying milk does your body good. We got to drink our milk to have strong bones, to get our calcium and our vitamins. Guys, I'm here to tell you that's false, okay? Absolutely false. We do not need to consume cow's milk in order to get our calcium, in order to get our vitamin D, in order to get our essential vitamins. Cow's milk is very, very inflammatory, very inflammatory to the human body. Our bodies are not designed to drink cow's milk. See, the biggest problem with cow's milk, and the reason why it's so inflammatory, is because the sugar that's found in milk, which is called lactose, you need an enzyme called lactase to break down that sugar. Now, that enzyme is naturally found in cow's milk so that when the baby cow consumes the milk, it has that enzyme to break down that sugar. Well, when you go through the pasteurization process of what they do to milk to heat it up to kill all the bacteria so that it's safe to consume, those enzymes are killed off. So a lot of people say, well, I'm lactose intolerant. Well, I'm here to tell you everybody is lactose intolerant. Some people are just symptomatic and some people are not symptomatic. See, our bodies don't make that enzyme lactase to break down the sugar lactose. And so we are not able to break down that sugar when we consume a pasteurized cow milk. They also homogenize the milk. So all the beneficial fats that are naturally found in milk, so those that are drinking raw cow milk, they are getting some benefit from that fat. Well, when you put it through the homogenation process, they remove all that good healthy fat from the milk. And so really you're just looking at a white dead substance that's very inflammatory. They put artificial vitamins back in it that your body really doesn't absorb and really doesn't do your body any good. So I'm here to tell you, stop drinking cow's milk. That big glass of milk that you're drinking at dinner time is doing you nothing but harm. It's causing more inflammation. Now, as far as cheeses go, and this is going to tie into my tip here, just wait another couple minutes here. I'm going to talk to you about that tip that I talked about, that there is no one diet. So is cheese okay to eat? Well, I would rather you do some goat cheeses or some non-cow dairy cheese, right? And so there's a lot of vegan cheeses out there that you can find that are pretty darn good. But at the end of the day, when cheese goes through the fermentation process, the bacteria eats all of that sugar, all of the lactose. And so what you're left with is mostly casein, the protein casein in that cheese. Now, very commonly, I see people that can't handle that casein. Well, doc, what do you mean by handle it? I mean, like when you eat cheese, you get digestive issues? Well, not necessarily. Hang on for just 1 minute and I'll explain to you what I mean. But cheese, we need to test to find out whether or not your body can handle cheese. So you can be allergic to cow's milk, but yet cheese is okay because the sugar is the main entity that you're allergic to. And when it goes through the fermentation process, again, the bacteria eats all that sugar, and so you're just left with the protein casein. So can your body handle casein, and how do I know what foods I should eat and what foods I shouldn't eat? Should I be counting my carbs? Should I be counting my fats, my proteins? Should I be counting all these individual nutrients? Do I need to be counting my calories? Do I need to be counting my micros and macros? Guys, I'm here to tell you no. I tell my patients, if you're eating the right food, if you're eating food that is fueling your body, eat until you're full and don't overeat, and you will see your blood sugars start to stabilize. See, so many people today are dealing with things like leaky gut, just devastated gut health. And so over the years, you develop food allergies. Now, the medical world calls these sensitivities, and the reason why they do is because you don't have an anaphylactic reaction, meaning your throat doesn't close up with these type of allergies, you don't break out in hives, you don't have an anaphylactic reaction. This is more of a delayed reaction. But the antibodies that I test for make up as much as 70% of your immune response. So even though you're not having an anaphylactic response to these foods, it's still creating a tremendous inflammatory response, which is at the end of the day going to cause more and more disease, more blood sugar spikes, more blood pressure spikes, and it's going to perpetuate any symptoms that you're dealing with. So what foods have you developed allergies towards over the years? And the fact of the matter is you have no idea unless you test. And this is what I mean by there is no one diet that is going to be perfect for every diabetic. This is why I haven't written a book on reverse your diabetes with this diet. Now, these 5 tips that I just mentioned to you, if you implement these tips, you're going to see improvement with your overall health. But at the end of the day, in order for us to reverse your diabetes, reverse your insulin resistance, get you to the point where you're not dependent on drugs, get you to the point to where you're not dealing with the complications of the disease, we have to test to find out what your body needs, not only when it comes to diet, but also when it comes to the treatment protocols. What organ systems aren't functioning properly? Do we have hormone imbalances, nutritional deficiencies, autoimmune diseases, GI infections? What is it that's driving inflammation in your body that's causing your diabetes to continue to progress? Well, one thing we certainly can do is test these food allergies so that we know what food is fueling your body and what food is poisoning your body. Yes, if you have allergies towards chicken, if you have allergies towards broccoli or cauliflower or Brussels sprouts, when you consume those foods, your immune system sees these as a foreign invader, not as fuel. The immune system flares up, it will attack those nutrients. At the end of the day, an inflammatory response will happen. And now we see a blood sugar spike, and this is where the frustration sets in. Because diabetics, they try to eat well, they get sugar spikes. They don't eat so well, they still get sugar spikes. If you go on and Google diabetic diet, hundreds of diets are going to come up, and they're all going to contradict each other. So I'm telling you that yes, these 5 tips will help, but if you truly want a customized plan based off of how food is interacting with your physiology to get the best results as quick as possible, reach out to me, click the link in the comments below, set up a call with me, and we can get that test kit sent to your doorstep. you can perform the test, and within as little as 2 weeks, we'll have that information back, and we can truly start moving you in the direction you want to move. Now listen guys, if you got anything out of this video at all, please subscribe to my channel, like this video, hit that bell icon so that you're going to get reminders when I have new videos. I'm always putting up free content on this channel to help diabetics live a healthier life and help them move towards a non-diabetic lifestyle. Bless you. We'll talk to you soon.